place of opportunity. Some people maybe call it the land of entrapment, but I call it the land of opportunity. I wanted to stay here, especially after residency training, was because the landscape, it was something about here that just felt like it was more in tune with just nature. And so it was that. The people were nice. They're treating you like an actual person and not maybe like any form of labels. So they're actually really trying to get to know you type of thing. The demographic is a little different here than where I've been trained. And first out the bat, there's not a lot of Black people here.
When my mother moved here, we said the Black population went up 25%. But in New Mexico, it's a bit different in that our population is so small, it's often invisible. And that's probably part of the problem here is that we tend to be a forgotten population.
When you think about the state of Black health in the United States, African Americans suffered from COVID at a disproportionately high rate. And I would suspect that you would find the same thing here in New Mexico if we were to dig down deeper. The African American population is generally working in lower wage jobs, and they were deemed needed. So when some of us could take off from work and shelter in place and work at home, they had to be out delivering your groceries. They had to be out working in other places that needed to be kept open. So I suspect some of that may have been happening here in New Mexico, but we just don't know. And until we find ways to talk with the African American community, literally go out and engage with them, then we're not going to be able to get a really good picture of what happened, I think, with African Americans in New Mexico with COVID.
COVID-19, the SARS 2.0, and I call it that because the first SARS event, happened in 2003 in China, and they were prepared for it. So they had facilities and things built up to manage it. We were asleep at the switch with this. In fact, in 2014, and looking at some of the data and some of the trends, I tried to tell the folks here in New Mexico that we need to start doing better surveillance and doing things, putting monies to get ahead of the curve on this. Nobody paid attention. Many of the disease conditions that people suffer from right now, the chronic disease conditions, disease of lifestyle, don't happen when all of a sudden somebody's an adult. These are things that start in childhood.
What we see is that, unfortunately, there are disproportionate number of African Americans that have comorbidities, hypertension, diabetes, asthma, obesity, things that were poor prognostic indicators for how well a person would do with COVID. And I think one of the things that we saw with deaths in the African American community were not only related to lack of access to care, but getting care late, sort of having a mistrust of the medical system because of past practices, whether that's discrimination or experimentation in this country. So I think what happened during the COVID pandemic is what we saw was COVID became politicized.
The issue is one of excess capitalism. Since you can make more profit on people being sick than you can on people being well. Although, if you understand prevention and public health, you begin to understand that if you have a healthy population, then you have a healthy economy. It brings to mind the reason why we have to talk about health equity. Because when we talk about COVID-19, one of the things that we talked about, at least in some parts of the country, in some places, was that equity is the only thing that's going to flatten the curve. We suffer from prevention deficit disorder. So everything that you saw on TV, basically, for the most part, or people, the pundits and people are talking about, was really always from the perspective of medicine and treatment and not prevention. Obviously, those pre-existing conditions are the things that would worsen a person's immunological status to a unique virus when it came down the pipeline.
When it comes to how to change that, there has to be support from the entire community, regardless of what you look like. It's not something that you can just say that, oh, that's your problem and you deal with it. No, it's going to be everyone's problem. This impacts everybody. how can we reduce these health outcomes in a non-pharmaceutical way.
So we're talking about upstream factors. What are upstream factors? What needs to happen to organize and to get better health outcomes for African Americans in New Mexico? Well, these upstream factors are things like, where do African Americans reside? Where are opportunities for healthy, affordable food that they can have access to? What does the transportation system look like across New Mexico?
Where you live, work, play, and go to school has more of an impact on your health than your genes.
So there are many things that we can do to improve the health of the whole country that in turn would affect the health of African Americans within this country just by default.
Biases exist, they're going to exist, and what we need to do is put in processes to take that out of the equation as much as possible. There was an interesting study with lung cancer and the time from diagnosis of lung cancer to getting surgery for that cancer. And there was a bigger gap for Black patients. And so what this study did was, rather than trying to go in and talk to providers and say, you're being biased, blah, 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 all these things, they said, let's just fix the process and put in things that take the human part out of the equation. And what they found was that the percentage of people getting surgery on time went up for both groups, and the disparity disappeared completely. But it takes institutions taking the time and the effort to look at their processes and fix those. And this is one of those situations of someone trying to build a plane while it's flying. They're so busy with everything else, it's hard to get institutions to stop and fix an entire process. But that is part of the work I think needs to be done.
How much better would the health be if everyone could get to a grocery store with affordable, healthy food? If everyone could actually earn a proper living? You know, it's complicated, right? It's complicated, and all communities, even within New Mexico, are not the same. Many people who live here are not from here. And so you truly have an African diaspora here, right? And so I think having a thorough survey, being thoughtful, and really critical are going to be key. So I think those are the things that we need to address.
It's going to take a revolution of consciousness. So we need more stories. I think there is a tremendous need to really improve this phenomenon known as health literacy. Our biggest enemies are fear, doubt, ignorance, superstition, apathy, and irreverence. And the only way we're going to overcome that is to establish truth, justice, mercy, and compassion.